So how do we decide on breast volume? Well, there is a plethora of information out there, and it really does depend on each respective surgeon's preference and individual exposure to what they're used to. They can range from digital enhancements to volumetric measurements using chicken fillets or rice, or others may just use tape measures and calipers to help you decide. The most important thing is there is no right or wrong answer, and it really is dependent on each surgeon's preference and what their level of exposure is. Before we go down my preferred method, I'm going to ask you to do 3 things. Number 1 is ignore cup sizes, because cup sizes can be very different to the individual person, and depending on what shop you go to, the bra size can be very different. Number 2, ignore cc's. Now, I've had patients come in and they say, I want 250 cc's. Well, this is maybe suited to a friend, but again, it's very individual to the person. So if you're very tall and broad shoulders, 200 cc's may not have the same dramatic effect than if you were quite petite with already some volume. So cc's is also something that we will try and avoid talking about when it comes to expectations. The other thing I'd like you to avoid using is subjective terms like I want to be medium or I want to be big, because your version of big and my version of big may be very, very different. So now that we've got that out of the way, we're going to go to the method that I use. I use a 3-step technique, and the first step is assessing or establishing what your expectations are. The second step is seeing whether those expectations can be met, so reality versus expectations. And the third step is surgical confirmation. So the first step, managing your expectations or establishing your expectations, is when I will ask you to do the rice test. And what this involves is getting some uncooked rice, placing it in a bag or some pop socks or socks. You don't have to weigh it. If you could get yourself a soft cup non-wired bra and place the rice in the bra, you can flatten it out for ease, wear a tight top over it and then your normal clothes, and have a look around various mirrors in the house. You can ask for your friend's opinion or your partner's opinion, but remember, this is your choice and your decision when it comes to final volume. You may find it helpful to go shopping with the rice in, just to give you an idea whether you'll be able to handle any potential extra attention. Now that we've decided, or we've figured out what your expectations are, in the second consultation I will weigh these and decide whether your expectations can be met. I may say yes, it's possible, which is great, or I may say actually it's a little bit too big for you, it's not good to get long-term, I won't be able to get long-term results, let's go slightly smaller. Or I may say yes, it's possible, but I may need to do some additive surgical procedures like skin tightening to help you, give you the optimum result. I will convert, after our discussion, I will convert our rice to silicone testers, and I will test these at the second consultation, and we'll get you to look in the mirror. At this point, you will have an idea of what volume cc implant that you may have, and I will order a range of implants based around the volume that we've decided on at this point. That moves on to the surgical confirmation. So all the volumes of implant that I've ordered, I will place these while you're asleep inside and sit you up and lie you down while you're under general anaesthetic to see what will be suited to your body using the information that we've gathered from our previous consultation. So hopefully we'll be able to get the perfect volume for you. Hope this information helps. If you have any questions, comment below, and please subscribe for any further updates. Take care.